We are making progress, I think, in the upfront treatment of newly diagnosed ovarian cancer. As I mentioned, about 70% or 75% of women present to their doctors already having advanced disease, where the illness is already affecting the tissues in the upper abdomen, causing abdominal distension, sometimes fluid formation called ascites. We have made some progress in this treatment. 30 years ago, there was no cure at all for women in this illness, but one of the things that we've discovered and we've learned through doing clinical trials is that women that have an aggressive surgical debulking procedure followed by chemotherapy have, in many cases, somewhere between a 20 and 25% of a long-term disease-free survival. Medical oncologists hate to use the word cure because the word scares us, but a long-term, more than 5-year disease-free survival is often an indication that the disease isn't going to come back. We've also learned a number of other things. The first is that the extent of surgical resection and treatment by a gynecologic oncologist up front is very important in long-term overall survivals in women with this illness. And we've also learned that treatment with intraperitoneal chemotherapy is very important in providing the best long-term outcomes in this illness.